Hello and welcome. My name is Laura Cruz. I am the Director of Benefits Access at Senior Resources Agency on Aging, and we're located in Norwich, Connecticut. Before I discuss the Medicare open enrollment period, I would like to provide a brief overview of the agencies on aging, now known as the AAAs. Senior Resources is one of the 5 AAAs and provides services and supports to a 56-town area consisting of Middlesex, New London, and Wyndham counties, and we serve 5 towns in the Tolland area. If you're attending this presentation from another area in the state, no worries. You have an area agency on aging in your area. AAAs serve as a one-stop shop for information about programs, services, housing options that are available to our aging population. So if you have questions about aging, your AAAs have the aging answers. If you're not sure where to turn to, call us and we can help direct you. You can reach Senior Resources directly by calling our local number of 860-887-3561. But if you're calling outside of our area, utilize the toll-free number of 1-800-994-9422, and you should be connected to your local agency on aging. Of course, you can always send us an email or even a message through the regular mail, and we look forward to speaking with you. Before I get into the actual topic of Medicare, I do want to do 2 programs of note. One is the Senior Medicare Patrol, SMP. Billions of federal dollars are lost annually due to Medicare fraud, waste, and abuse. The SMP program combats those issues. They will provide one-on-one counseling and assistance to people on Medicare. Counselors are available to help beneficiaries read their Medicare summary notices, review their cases, and understand billing and other paperwork. In suspicious cases, SMP can help beneficiaries to report fraud to the proper authorities, which includes inappropriate insurance agent behavior and marketing violations. If you suspect Medicare fraud, call your local AAA and ask for the Senior Medicare Patrol. And as you can see, they are co-located in most of the area agencies on aging, but connect with us with the toll-free number, or in Eastern Connecticut, connect with us at our regular phone number of 887-3561. The second program of note is probably the reason why you're here. The State Health Insurance Assistance Program is a national program that offers one-on-one assistance, counseling, and education to Medicare beneficiaries, their families, and caregivers to help them make informed decisions about their care and benefits. The State Health Insurance Assistance Program supports people who are eligible for Medicare regardless of your income, Medicare beneficiaries under the age of 65 with disabilities, and individuals who are duly eligible for both Medicare and Medicaid. In Connecticut, your State Health Insurance Assistance Program is known as Choices. So from now on, I will refer to us as the Choices Program. Choices provides free, unbiased assistance with the Medicare program, and we accomplish this mission by recruiting and maintaining a robust network of volunteers and in-kind professionals to provide these counseling and eligibility screening services in your area. Choices counselors are not insurance agents or brokers, so we do not gain financially from your decision. Choices, like many Medicare beneficiaries, use the federal tool, the Medicare.gov website, to provide you direct information about the Medicare plans and provide enrollment assistance into a drug or Medicare Advantage plan through that portal. Now, the reason why you're here, let's talk about the Medicare annual enrollment period. You have many resources available to you right off the bat. Number 1, if you're actively enrolled in Medicare, you should have received your Medicare and You 2026 handbook. Please open that book, thumb through it, read through it, because it does provide you a plethora of Medicare information and the options you have available to you. Of course, you can connect with Choices, your state health insurance assistance program, and you have the Medicare.gov portal, which I will again reference several times throughout this presentation. A couple things to be known about and things that are already in effect. Recommended vaccines, adult vaccines I should say, are free of charge for people with Medicare Part D, which is your drug plan. That includes RSV, shingles, tetanus, diphtheria, pertussis, also known as the whooping cough, hepatitis A, and hepatitis B vaccines. If you do have diabetes, you can be covered, your insulins would be covered at no more than $35 per month per insulin. So this is actually a great cost savings that has taken place and it's just really helping to make insulin affordable for those that have to self-inject. Also continuing in 2026 is for 2025, there was a maximum out of pocket that Medicare beneficiaries have for them to ensure that they're not spending any more than a certain amount of money per year on their covered prescriptions. So this year it was $2,000. Fortunately, next year that is going to increase by $100. So you do have a cap on your covered prescription drugs that you would spend no more than $2,100 in 2026 for your covered medications. This includes the calendar year deductible and your cost shares. That means your copays or coinsurance is due for each medication. If you do happen to reach $2,100 in 2026, you are then covered at 100% for your covered formulary drugs for the remainder of the calendar year. This does not include your monthly premium, though, that is attached to your drug plan and or your Medicare Advantage plan with drug coverage premium if you have one. Also beginning in 2025 and continues next year, Medicare now has a Medicare prescription payment plan. This is a payment option that works with your drug coverage, whether you have a standalone drug plan or you have a Medicare Advantage plan with drug coverage. This helps you manage high out-of-pocket costs by basically spreading them across the calendar year. Anyone with a Medicare drug plan can use this payment option, and all Medicare health plans and Part D plans must offer this option, but the participation is voluntary. If you select this payment option, you will receive a monthly invoice from your prescription drug plan. So when you go to the pharmacy counter, you may not have to pay at the pharmacy counter, but you are going to get a monthly invoice that you do need to pay each and every month. So again, this just helps manage your monthly expenses, but it doesn't help you save any money. It doesn't lower your drug costs. So this is really good for individuals with very high out-of-pocket drug costs, especially at the beginning of the year. You might benefit from this option. So it will help lower it. So again, unfortunately, it's not going to help lower your drug costs, but it just helps spread those drug costs throughout the calendar year. If you are interested in this added assistance from your plan, you have to call your prescription drug plan directly to enroll into the program. We at Choices cannot assist you with that. We also suggest that you create your Medicare.gov account. Why? Number one, it gives you immediate access to your Medicare information. If you're not quite sure exactly what your Medicare current coverage is, this is a way to find it out, and it's also just a better way to build a drug list. Each year, Medicare will basically provide you information about what drugs did you fill within the last 12 months. So if your drug list itself, if you have a handwritten one, isn't quite up to date, you will see that you have access to that, and it will help people who are assisting you, like Choices, to screen you correctly when it comes to reviewing the drugs that you have on the list. So it basically just makes it a lot easier to compare the standalone drug plans or the Medicare Advantage plans with drug coverage by going through your personal Medicare.gov account. And it is also great for an individual that may receive assistance through the state of Connecticut Department of Social Services, where it shows your extra help status, and it will help review your drug costs based on that financial assistance you are receiving through the state. Now, plan material, and this section is very important. First of all, your annual notice of change. Your plan sends you this document each fall. You should already have it. If not, I would reach out to your company and ask for them to send it to you again, or you might be able to find it on their website. This document describes any changes in the cost of the monthly premium, the deductible, the drug coverage copays or coinsurance by tiers, such as tiers 1 through 5, pharmacy network changes, but it typically doesn't list it in the document. It just tells you to call the plan directly to find out what pharmacy changes might have happened, and changes to their formulary. Again, it doesn't state exactly what drugs were added or removed. Excuse me, it does direct you to the plan. Sorry, I do have a cold. So when you do receive that document, what it will do is it will compare 2025 costs to 2026. Please look over that document. If you find that this document and you're happy with the changes, or maybe not so much happy with the changes, but you're okay with them, then it's okay to stay with the plan that you currently have. You don't have to make plan changes. But of course, we're going to encourage you to be screened each and every year just to make sure you are on the best financial cost program for you that covers not only your drugs, but if you're looking at an Advantage plan, that all your other healthcare needs are covered. If you receive assistance through the state of Connecticut, you'll also, in a separate envelope, receive what's known as an evidence of coverage rider. This means if you're receiving the extra help, it just provides you a little more detail about what your plan's premium might be, and of course what your cost shares are going to be for your covered drugs. Two other documents that you have available to you but is not sent to you. It's called the evidence of coverage. This is a very large document. I don't suggest printing it out because it can be upwards to 200 plus pages. But this is especially important for those that are in a Medicare Advantage plan. It really does give you the ins and outs of the plan that you're enrolled into and where you might need to go to receive certain healthcare services, or where you might need to go if you need to purchase things like durable medical equipment, which includes your diabetes testing supplies. Another booklet that I really love is the summary of benefits, especially if you're in a Medicare Advantage plan. This is about a 15-page document that describes to you what your financial liability is going to be with the Medicare Advantage plan that you are enrolling into. If you're in a standalone drug plan, you do have access to that booklet as well. That just basically pertains to your prescription drug plan only. But I do suggest that if you're in a Medicare Advantage plan, you do get your hands on the summary of benefits booklet, because it's just a really great, like I said, a very small pamphlet that provides you direct information about what your financial liability is going to be with the plan that you enrolled into. Now, plan non-renewal notices. Previous years, this really didn't affect Connecticut much. Unfortunately, it is going to affect a lot of Medicare beneficiaries for 2026. I will get into it a little bit more further down the presentation, but there are several plans that are not renewing. So you do need to pay close attention to those letters that you are receiving, because it's giving you the description of what you need to do and the time frame of what you need to do it by. If you choose not to act, you may have no drug coverage or a Medicare Advantage plan for next year, which is going to put you in a bind, not only health-wise, insurance-wise, but perhaps financial-wise. If you go without having certain parts of Medicare, you might be penalized at a later time. And if you do receive some form of state financial assistance or even federal financial assistance, you might receive color-coded letters from the Department of Health and Human Services, that's known as DHHS. They send you certain color-coded letters to indicate maybe your extra help status, some of the changes, you might be automatically enrolled into a different plan. So again, it's very important to open up any envelope from the current insurance plan that you have, or any envelope that says the Department of Health and Human Services. Most of the other letters in your mailbox is overflowing right now, I get it, would be information from other insurance companies that are soliciting your business. Soliciting their business and attempting to get you to enroll. It's okay to open up any of those letters, but do not respond to anything until you do your due diligence and screen yourself for what's available for next year. So again, a little bit more about the plan non-renewals. So for the standalone Part D drug plans, Cigna has been acquired by Healthcare Service Corporation, and it did eliminate 2 out of the 3 drug plans that Cigna had. So if you look at your insurance card, your drug card, and you see that you have Cigna Extra or Cigna Saver, you need to act. You should have received a letter stating that those plans were not going to be available next year, and you need to act. The third plan that they have, excuse me, Cigna Insurance RX, it is now going to be called Health Spring Assurance RX. So again, you should have received a letter. You should also receive a new insurance card with the new information on it. But again, you want to act because you need to see if this plan is still going to cover your medications and if you're okay with the plan's premium. And if you are a WellCare member, WellCare has, I believe, 3 different standalone prescription drug plans. They are removing one of them. So if you are a holder of the WellCare Medicare RX Value Plus plan, that plan has been eliminated. You should have been notified with a letter, and it indicates what your options are. I have not heard back yet from Medicare beneficiaries indicating if they're just transferring you to one of their other plans. But if they're not, then you do need to act and make sure you enroll yourself into a new plan that suits your needs. In the Medicare Advantage plan world, Medicare Part C statewide, anyone who has one of these 2 plans, the AARP Medicare Advantage from United Healthcare, and it ends in 0004 or 0005, those 2 plans have been eliminated and they're no longer being sold. So you should have received a letter by now indicating that that plan is not available to you next year and you need to make a plan change. And then by county, so again, I serve Eastern Connecticut, so I can only speak for the counties that I serve. If you have any questions and you're outside of the counties that I serve, do call that 1-800 number so you can speak to the AAA Choices program that serves your area. But I can tell you, Anthem Blue Cross Blue Shield is not offering their regular Medicare Advantage plans in New London County or Tallinn County. The only plans they're still going to offer are those that do qualify for some form of Medicaid through the state. But if you're not eligible for any assistance through the state of Connecticut, you're an Anthem Blue Cross Blue Shield holder, and you live in New London or Tallinn counties, you should have received a letter indicating that your plan is not available next year. I know they're going out because our agency is already chocked full with hundreds of calls so far indicating that your plan's not available and you need to make a new plan choice. So what is the Medicare annual enrollment period and what can you do? So this is for current actively enrolled Medicare beneficiaries. Use this opportunity to review your current healthcare choices and make sure that they're still going to be good for you for the next year. You can do this anytime between October 15th, but it does end December 7th. If you choose to make a change, meaning you enroll into something new, that plan will become effective January 1st. So you still have what you have for the remainder of the calendar year. Your new plan would not begin until January 1st. So again, for help in Eastern Connecticut, call our local office at 887-3561. Ask for extension 202. It is an extremely busy time right now. As I previously said, we've already received hundreds of phone calls. So at this point, we may be about 48 business hours behind, but you will get a phone call back. And we do have some in-person appointments available left. Otherwise, we will do the majority of our counseling over the phone. And of course, we can set up appointments like this via Zoom if you wish. We can do that too. It at least gives you the one-on-one opportunity. It's just through a screen versus sitting in an office with someone else. So this is what you can do during this time period. You can do a lot of things. You can switch from one Medicare Part D plan to a different Part D plan. You can switch from a Medicare Advantage plan to a different Medicare Advantage plan. You can switch from original Medicare and go into a Medicare Advantage plan if you want to try it out. What you will need to do though is if you do have a Medigap, also known as a supplemental plan in place, you will have to terminate that. By law, you cannot have and be sold a supplemental Medigap plan if you're enrolled in a Medicare Advantage plan. So connect with your Medigap plan carrier, let them know that you are switching to a Medicare Advantage plan and you need to terminate your plan. By enrolling into a Medicare Advantage plan, you will be automatically terminated from your current prescription drug plan, and it will end as of December 31st. And then as of January 1st, your Medicare Advantage plan with drug coverage will assume responsibility for your care. You can switch from a Medicare Advantage plan and go back into original Medicare. And my next couple slides, I will explain the two different options that you have. But the easiest way to do that is enroll in a standalone Medicare Part D plan. And what will happen is your Medicare Advantage plan will be terminated at the end of the year, and your new standalone prescription drug plan will begin January 1st. Of course, if you choose this route, you should consider purchasing a Medigap supplemental plan to help offset the costs of what Medicare Part A and Part B says is your responsibility. Now, if you've never chose a prescription drug plan, or if you weren't enrolled in a Medicare Advantage plan with drug coverage, this is also the opportunity for somebody to join a drug plan for the very first time. I will caution you though, and please reach out to Choices, you might incur penalties. So if you've gone without a prescription drug plan from the day that you should have enrolled into one, you might incur monthly premium penalties that will be added on to your prescription drug plan, or if you choose to enroll into a Medicare Advantage plan with drug coverage, penalties will be added on to that. So give us a call. Let's discuss your situation. We can provide professional guidance to see if you might be penalized or not, and screen you for other programs that might wipe away those penalties. So I'm switching gears now. I want to get into the actual options and considerations that you have available to you. But of course, I've got a quick little disclaimer for you. If you are a retiree from an organization that provides you a retirement health plan benefit option that wraps around your Medicare benefit, you should be connecting directly with your health plan benefits administrator or your former HR department. Because if you choose to go off on your own and enroll into a drug plan that you saw on TV, or maybe a Medicare Advantage plan because you saw this commercial and it sounded wonderful, do be very careful. Because if you choose to enroll into a Medicare Advantage plan or a Medicare Part D plan, you are going to unravel your retirement health plan. And your retirement plan is going to terminate you from their coverage. And guess what? There's no law that states they have to take you back. Some are very strict with it and say, if you are terminated from us, you're terminated. We don't have to allow you back into the plan. Well, some other health plan benefits administrator are a little bit better about it that says, yes, show us proof that you terminated the plan that you didn't need to enroll into, and we'll take you back, no problem. So if you are, say, a state of Connecticut retiree, a Connecticut teacher retiree, if you retired from a town municipality, any of those options, you have your own folks that you need to go through, and do make sure you do to see if there's any changes that are available to you. But for all others who do not have access to a retirement health plan, when it comes to receiving your Medicare benefits, you have two options to choose from. And I have a graphic on the next slide to kind of help you view what options you have. But you basically have Original Medicare, or you have the Medicare Advantage plan. So let's discuss that a little bit further in depth. So left-hand side, you have option 1. This is the Original Medicare model. Your red, white, and blue card would be primary. So Part A is your hospital coverage. Part B is your medical coverage. You should add on what's known as a Part D plan. That is the prescription drug plan that's going to help you pay for drugs at the pharmacy counter. You should also purchase a Medigap plan, a supplemental plan, to help offset the costs that Medicare Part A and Part B says is your responsibility. It's important to know that this model does not cover routine dental, vision, or hearing. So typically you are on your own for that, or you might have to purchase additional insurance to help cover those services. But with this model, there's no need for prior authorization. This model is very portable, which means you can go anywhere you want within the United States for services and coverage. But typically, because premiums, you'll have 3 separate premiums with this model, it could be more expensive than the Medicare Advantage plan. Now, option 2, you do have the ability to enroll into what's known as Medicare Part C, as in Charlie. It bundles your Part A and Part B, and many times wraps your prescription drug plan into one private health insurance company that has been approved by Medicare. So essentially, if you enroll into a Medicare Advantage plan, that private insurance company now assumes the role of providing you your hospital coverage, your medical coverage, and many times your prescription drug plan coverage. And like I said, it wraps it into one insurance plan, so you will be carrying that one insurance card with you. You still have to pay your Part B premium, can't get away from that. And a lot of the Medicare Advantage plans have no additional premiums to pay, but be on the lookout because some of them do have an additional health plan premium or a Part D plan premium. These plans may offer additional benefits such as some coverage for dental, vision, and hearing, and maybe a little bit more, maybe a slight over-the-counter benefit or maybe a fitness benefit. So they're typically premium-wise less expensive than the original Medicare model, but on the flip side is typically you have to use healthcare networks in order to receive your care, and it also does utilize prior authorization for a lot of the services that you might need, like diagnostic imaging, or if you need to go see a specialist. So let's break those down a little bit more. Just a quick review of the original Medicare model again is Medicare Part A is your hospital coverage. This helps pay for inpatient hospitalization, skilled nursing facility care at a nursing home, if you qualify, home health care, and hospice care. Generally, it's premium free for most, but you do have things called a per benefit deductible, copays, and coinsurances. So again, you really need that Medigap plan to help offset that costs should you enter the hospital and incur those deductibles, copays, and coinsurances. Medicare Part B is your medical coverage. This helps pay for your doctor's services, whether you're inpatient or outpatient. Outpatient care, like say same-day surgery, and more, things like diagnostic imaging, if you have to go to a freestanding clinic to get like an MRI done or a CAT scan, ER charges if you went to the emergency room and you're not admitted, that is all considered outpatient and would be covered under Medicare Part B. Everybody pays a premium for Medicare Part B. Unfortunately, your 2026 premiums have not been released yet. This is typical for this time of year. Usually those premiums, deductibles, and copays amounts are not released till towards the end of November. I am recording this during, of course, the federal government shutdown, so I'm hoping by the time you review this, things have changed and this information will be released to you. But check back to Medicare.gov routinely, because as soon as that information is announced, Medicare.gov does a great job with updating the Medicare costs for the following year. So just be on the lookout for that. And after you incur and meet your calendar year deductible, Medicare then pays 80%. Again, 2026, I don't have the Part B deductibles yet. Hopefully by the end of November, it will come to fruition. So again, check back with Medicare.gov, or of course you can call Choices routinely to see if we have heard anything either. And usually it's plastered on other social media platforms as well, or perhaps the news. But again, keep in mind, original Medicare doesn't pay for things like routine dental, vision, or hearing. You should consider purchasing a Medigap plan, which is additional insurance that will help offset those Part A and Part B cost shares. If you would like the current rate sheet, definitely give us an email, because we can at least send it to you via email. And this rate sheet that Choices creates, we get the information directly from the Connecticut Department of Insurance, and we break it out to what insurance companies are selling Medigap plans. It shows what plans they are selling, because there are multiple, and of course what the premiums are per person per month. So if you are interested in a Medigap plan, email us. We'll be very happy to send you the rate sheet. And then of course you do need to add on the Medicare Part D plan, a standalone drug plan. These are, again, this is just additional insurance that helps you pay for prescription drugs at the pharmacy counter. And while Medicare Part D is voluntary, That is true. Unfortunately, if you choose not to have a drug plan, a creditable drug plan in place, and later on in life you need one, you are going to be penalized, and you will have to wait for certain enrollment periods in order to enroll into one, which is generally during this time period now, which means your coverage won't begin until January 1st. And a quick little review about Medicare Part C. Again, these are private health insurance companies that are approved by Medicare that basically assume the role in your hospital and medical coverage. And many times it does include your Part D. So you must have Medicare Parts A and B to enroll into one of these plans. And yes, you must continue to pay your Part B premium. There's no way getting around that. Some plans may offer a Part B reduction, which means they may help you pay towards your Part B premium. They'll make a payment to the Social Security Administration, and you will owe the remainder, which typically comes directly out of your Social Security benefit. If you are not collecting Social Security yet, which is perfectly okay, you typically receive a Medicare invoice to pay your Part B premium, and then you'll end up having to pay it that way. With these type of plans, you do have an out-of-pocket cost. And basically how I describe it is these types of plans are a pay-as-you-go type of plan. So basically every time you utilize the healthcare system, you're going to have some form of a copay or co-insurance due when you access your healthcare providers or hospital services. You cannot be sold a Medigap policy to help offset those costs. That's why it's very important for you to understand your financial obligation with these types of plans, so there's no surprises to you in the event that if you're hospitalized and you get a bill for $1,700 or more, so you know exactly how much you are liable for and responsible for. But all these plans do have what's known as a maximum out-of-pocket protection, a MOOP. What it is for your healthcare services. This does not include your drug plan, nor does it include any of those extra benefits that they may cover, like dental, vision, and hearing. This is strictly for services that would normally be covered by original Medicare. So if you enter the hospital or all your doctor's services, it is a set amount by your plan that says if you just happen to spend this set amount of dollars that we state, then you'll be covered 100% health-wise for the remainder of the calendar year, and you'll no longer have to pay co-pays or co-insurances to your healthcare providers. So again, knowing what that MOOP is, so you can be better prepared when you receive invoices from your healthcare team that says, okay, your insurance paid, now this is your responsibility to pay. And as stated before, many of these plans do offer extra benefits, such as dental, vision, and hearing. On a bad note for 2026, we are hearing and seeing that a lot of these extra benefits are being reduced, so you have to read your plan's material very carefully to fully understand what your coverage is. So how do you find, definitely if you want to screen yourself for other plans that might be available in 2026. Time of year, I apologize. Definitely go to the Medicare.gov website and utilize what's known as the Plan Finder tool. This tool can help you determine what standalone drug plans are available in 2026 and what Medicare Advantage plans are available in your service area, your zip code area, along with their health plan benefits and extra benefits that might be available on the plan. You can also use this portal to enroll into a new plan. So if you do this screening on your own, which is perfectly okay to do, and you like what you see and you want to do this change on your own, when you're in the plan, simply click the green enroll button, walk through the process, and there you go. You'll end up, after you follow all the screens, the enrollment process, do make sure that you print out the confirmation page. That gives you a confirmation only that you started the enrollment process to enroll yourself into a new plan. And to be honest with you, this is what Choices counselors utilize when we assist you or to help facilitate enrolling you, if you wish, into a new drug plan or a Medicare Advantage plan. Unfortunately, choices cannot assist you with if you choose a Medicare, a Medigap policy or supplemental policy. You typically do need to go through the plan directly to enroll yourself or change to a different Medigap plan, because that insurance carrier does need specific information from you and typically has to fill out what's known as basically an application. So unfortunately, we can help with Part D or Medicare Advantage plans. Choices is unable to assist you with enrolling into a Medigap policy. New for 2026 is if you are searching for Medicare Advantage plans, the Plan Finder tool is now giving you the option to add in your health care provider team. So if you see 5 different healthcare providers, you're able to enter them prior to actually seeing the plans. So this will help decipher the available plans that are in your area. And when you finally get to the screen where you can view all the plans that are available in your zip code, it will actually tell you on the right-hand side. It will have your doctor's name and whether they participate with the plan or not. So if you see a doctor that has an X next to their name, you might want to stay away from that plan, because it means that your healthcare provider is not part of that Medicare Advantage plan. Or if you do still want to enroll into that plan, it means you might have to find a different healthcare provider. So this is new. I imagine there's going to be hiccups with it, so just keep that in mind. Professionally speaking, I would always encourage you to connect with your healthcare team, all your doctors that you see routinely, and of course the hospitals that you like to utilize, just to make sure that they're still in the network. You can do that by calling your doctor's offices, or you can call the plan directly, or go online to the plan's website and run your doctors through their provider search. A little concerned because this is a brand new function, and we're just all going to be seeing the same thing. So I hope it works great, but I just do want to let you know what is available to you. So before selecting, or when you're looking at your current plan and before selecting a new plan, these are considerations that you need to take into consideration before changing or sticking with the plan you have. So when you're reviewing the drug plan portion, I want you to consider, are all my drugs covered? That means if you take 5, 10, 15 different medications, are they all on the plan's formulary? If they're not, you might want to look for a different drug plan. If there's no drug plans that cover every single one of your medications, I do want to let you know you're going to have to go through what's called a coverage determination process and attempt to ask your plan to cover the medication that you're taking, and basically it's an appeals process. It is available to you. We'll never guarantee that your plan is going to approve in your favor, but we can provide you more details on the coverage determination process. You want to know what the calendar year deductible is. Next year, the deductible is $610 for most insurance companies, unfortunately. But you do want to find out if the plan you're enrolling into does have a deductible, and are all your tiers applied to that calendar year deductible. You need to know, do you have restrictions on any of the medications you take, such as will you need prior authorization? Does it have quantity limits, which may restrict you to the amount of medication you can get per month or per 90-day period? Or does your drug have a step therapy restriction? Step therapy is a restriction that, let's just say there's 3 or 4 different drugs that will help you with the condition that you're taking it for, but those 2 or 3 other drugs are cheaper than the one that your doctor has prescribed. Your plan may require you to try those alternative drugs first before they'll finally approve the drug that your doctor prescribed in the first place. You do want to find out if you can go to the pharmacy of choice. I would suggest that when you're running your prescriptions, you add in at least 2 or 3 different pharmacies, because you'd actually be amazed on how much money you could spend each year just by switching pharmacies, because some drug plans have better contracts with different pharmacies. But you do need to determine that if you're keeping your plan or the new plan you want to enroll into, you do want to see if the pharmacy you absolutely only will go to is in the plan's network. You do want to know what the star ratings are of the plans. The star ratings take into consideration a lot about what has happened during the previous calendar years. So it takes into consideration customer service. If you did have an issue with the plan, did they resolve it? A whole bunch of things you can find out about the star rating. And if you go to Medicare.gov, all the star ratings now are on the plans. And if you go all the way to the bottom of the page of the plan that you're looking at, you can actually maximize where it says star ratings. You would be able to check the plus sign and it will open up a box that shows you where they scored by Medicare, CMS, and how they rated and how they came up with the rating for the plan. And last but not least, you want to know what is it going to cost me for all of 2026 if I choose to enroll into this plan. So again, the Medicare.gov Plan Finder tool is a great source to review your plan's coverage and see what's good for you. Again, Connecticut has lost a considerable amount of plans over the following years, the past years. So for 2026, you're limited to 11 different standalone drug plans that may suit your needs. And of course, I already mentioned star ratings. If you are enrolling into a Medicare Advantage plan, here are some things that you need to consider. So if you're actively enrolled in a Medicare Advantage plan, consider these following options. If you're considering enrolling into a Medicare Advantage plan, consider these options. You do need to ask yourself and verify, besides for my monthly Medicare Part B premium, is this plan going to charge me an additional health plan premium or drug plan premium? And does it want to charge me for extra benefits? Some plans do not offer comprehensive dental, and if you want that package, you do have to add on their dental rider, which is an additional premium that you would have to pay per month if that's the plan you choose. The previous screen, are all my drugs covered? You want to ask those same questions when it comes to the drug plan portion of the Medicare Advantage plans. You want to know, what are your health plan out-of-pocket costs? So what are your doctor's costs? What are your specialist costs? If you are admitted into the hospital, what is your cost? Do you have a health plan deductible with that Medicare Advantage plan? These are all questions that you want answered prior to signing up for the plan or sticking with the plan, so you are not shell-shocked if you get a bill after you've had a hospitalization stay. You want to find out, do you need prior approval to go see a specialist? Do you need a prior authorization in order to get certain items, services, and supplies? So if you need things like an MRI or a CAT scan, your ordering physician typically does need to go to your plan to explain why you need this, and you do need that prior approval before you have that exam or test done. If your plan requires it, but you go ahead and have that test done anyways, and lo and behold, it doesn't get approved, you're on the hook for 100% of the costs associated with that service. So please be very, very careful. You do want to ask, is your healthcare team, all your healthcare providers and hospitals, are they in the network, especially for HMOs, health maintenance organization plans? And it's because HMO plans have in-network benefits only. So unless you are in an emergency situation where you need immediate medical intervention or you might expire, your HMO does have to cover you as if you're in network. However, once you are stabilized, if you are receiving care from a non-network provider or a non-network hospital, you're going to be on the hook for the remainder of the charges, and that can spell financial disaster for some. If you do like the flexibility of seeing whatever doctor you typically want or go to whatever hospital you want, you may want to look more towards the PPOs, which is the Preferred Provider Organization plans, which gives you the flexibility of receiving care in and out of network. But just keep in mind, you're saving more money cost-wise, copay-wise, if you use in-network. If you go out of network, your costs are typically higher, and it's usually a percentage versus a set copay. So again, find all that out before you keep your current Medicare Advantage plan or before you enroll into a new one. And of course, you should take into consideration the star ratings of the plans. So star ratings are from 1 being the worst to 5 being the best. Unfortunately, in Connecticut, we have no 5-star standalone drug plans, and we have no 5-star Medicare Advantage plans. They're all in fluctuation between 3 to 4.5 stars, which actually 4.5 stars is not bad at all. But do find that out. For some individuals who reside in Connecticut, there's help out there. And because we know Medicare is expensive, there's things, premiums, deductibles, copays. So if you qualify, there is help out there for you. And it's called the Medicare Savings Programs. As you can see, programs is plural. So that's telling you there's 3 different levels of this program. They each have an income bracket. So it's based on your gross income from all sources. Gross incomes before any deductions. So before any taxes are taken out or before any premiums are taken out of your, whether it's your Social Security benefit or your pension. You do need to list your full gross income on the application. And what these programs do is it can help pay your Medicare Part B premium. That is the premium that comes automatically out of your Social Security benefit. And depending on the level of help, it might also act as your secondary insurance, almost like a Medigap policy, where you might receive a gray state of Connecticut card called the Connect card that you can show to your healthcare providers, and it will protect you from your Medicare Part A and Part B deductibles, copays, and coinsurances. There's no asset limit to this program, which means you can have enough money, you can have any money in the bank that you have, whether it's your checking account or savings account, because your assets are not included. However, your interest in dividends from any asset does count as income, so you will have to remember to list that on the application. If you are approved for any level of the Medicare savings programs, you're going to be automatically enrolled into a federal program called the Low Income Subsidy, LIS. This has everything to do with your prescription drug plan that will help reduce the amount you have to pay for your prescription drug plan premium. It will reduce the amount you have to pay for your covered drugs, and it also will protect you from the calendar year Part D deductible. So here are the program income limits. Read over them carefully. And if you feel that you might qualify, reach out to Choices. We would love to discuss with you further in detail how wonderful this program is and how to go about applying for it. The State of Connecticut Department of Social Services is the administrator for this program, so you would be applying directly through the State of Connecticut Department of Social Services office to do this. We at Choices, we don't approve you for this program, we don't run the program, but we are tasked with the most important part is providing education about this program and how it can help you. So these income limits per level, and there's the income level brackets. If you are single, look at the single level. If you are married, you have to consider your joint income. Even if your spouse is not yet Medicare eligible, all that income counts. And if you are under those brackets, please give us a call so we can discuss it in detail. The income limits for 2026 do not change until March of next year. And typically we do not know the new income limits until probably the end of February. We have gone even well into March sometimes before that information is released from the Connecticut Department of Social Services. So I kind of got ahead of myself, but this is what the low-income subsidy is going to do for you if you qualify for any level of the Medicare savings program. So again, it's just going to help you reduce your out-of-pocket costs with the drug plan. So it will reduce your generic drugs to no more than $5.10 per generic medication, and it will reduce your name brand costs of covered medications to no more than $12.65. It will pay that calendar year deductible. So if you sign up for a drug plan that has that $610 calendar year deductible, no worries, you're not expected to pay that deductible. And it also does allow a special enrollment period to change plans throughout the year. This is a limited option and it's very narrow now, so I would suggest that you reach out to the Choices program for assistance. So basically, what can Choices do for you? Again, we provide conflict-free counseling and enrollment assistance into a new drug plan or Medicare Advantage plan. We'll screen your current plan and compare it to all the available options for 2026. We will provide enrollment assistance if you would like us to, but we do that through Medicare.gov. So again, we do suggest that you create your account for easy enrollment assistance. We will screen you for those financial assistance cost savings programs, the Medicare savings programs, to help make Medicare affordable. And heck, if you want to become a Choices counselor, if you want to learn all this, we have training opportunities for you next year. So if this is a role that you want to take on so you can help others, get in touch with me. If you're not within Senior Resources catchment area, talk to your local AAA and ask, how can you become a Choices counselor? And for my friends over at the Senior Medicare Patrol, I do want to add in one more slide about marketing violations. Here's a list of things that basically cannot be done through insurance brokers or agents. So if you could read over this screen, please do. But the bottom line is, you should not be receiving any unsolicited phone calls from a company that you have no relationship with. Companies that state that they're coming directly from or sent by Medicare, Social Security, or Medicaid, that is incorrect. They cannot represent themselves as, they're from Medicare or Social Security. If you get leaflets, flyers, or door hangers on your car at home from a company that you did not have an appointment with, they're not allowed to do that. If an agent returns uninvited to your home after perhaps missing an appointment with them, that is not allowed. And if you signed up for a plan after being told it had the coverage you needed but did not, again, hence the reasons why you really need to review the plans that are available to you, or if you were offered gifts to enroll into the plan. These are things considered marketing violations, and you should report them to your local SMP program, which again is co-located in 4 out of the 5 area agencies on aging. Eastern Connecticut is one of them, and our SMP coordinator does want to hear from you. So again, you need help. The Choices team is here to help you during this annual enrollment period. Please give us a call. Toll free, you can connect with the Choices team at 1-800-994-9422. If you are in Eastern Connecticut, which is New London, Middlesex, Wyndham counties, and a few towns in Tolland, as you can see here by the map, give us a call at our local office at 887-3561. Ask for extension 202. Again, I am going to state we have received hundreds of phone calls so far. We are slightly behind, so your call should be returned within 48 business hours, but we're very happy to make an appointment with you or go through your coverage over the phone, or of course we can schedule a Zoom appointment like this. And if you're trying to get in touch with us, you can always email us too at seniorinfo@seniorresourcesec.org. And if you do want a copy of this presentation, the actual slides, again, email us and we'll be very happy to email you this slide presentation. I thank you for listening to me. And again, we look forward to hearing from you. And if you have any questions or concerns, please reach out to Choices. I thank you, and I hope you have a wonderful day and good luck during this enrollment period. Take care.